ACE inhibitor refers to a class of medication that is used for different types of cardiovascular diseases, including patients with hypertension. To understand exactly what an ACE inhibitor does, following my explanation in the video renin, angiotensin, aldosterone, we need to remind ourselves that throughout the process of formation of these hormones, we need an enzyme that is called angiotensin converting enzyme, and this is the enzyme that changes angiotensin 1 to angiotensin 2. And then angiotensin 2 uses different strategies to increase the blood pressure, and also we know that angiotensin 2 stimulates cells in the cortex of adrenal glands to secrete aldosterone. Now, when we prescribe an ACE inhibitor, and the complete name is angiotensin converting enzyme inhibitor, means this is a molecule, this medication, that doesn't let angiotensin converting enzyme to do its job. So basically, ACE is not going to work and is not going to convert angiotensin 1 to angiotensin 2. So one of the effects of ACE inhibitor would be decreasing the level of angiotensin 2, and also we remember that angiotensin 2 is the one that has to stimulate secretion of aldosterone. So when we have a decreased level of angiotensin 2, clearly the result would be a decreased level of aldosterone. So we say, in short, the use of an ACE inhibitor decreases the level of angiotensin 2 and aldosterone. And knowing about the effect of these two hormones, now we can explain how the use of this medication helps lowering the blood pressure. First of all, we know that angiotensin 2 is one of the hormones that make systemic arterioles to constrict in order to increase the systemic vascular resistance and increase blood pressure. Now that we have a decreased amount of angiotensin 2, the systemic arterioles can stay wide open, which that leads to reducing friction between blood and the wall of blood vessel. Basically, systemic vascular resistance decreases, and the result would be a decreased blood pressure. Also, we know angiotensin 2 is one of the hormones that impact kidneys and make kidneys to not eliminate water. Now that we do not have sufficient amount of angiotensin 2, the opposite happens. Basically, kidneys eliminate a large volume of water. Basically, the volume of urine increases, and that would lead to a decreased blood volume and a decreased blood pressure. And let's not forget that aldosterone also is one of those hormones that reduces the urine volume, since in this case, by using ACE inhibitor, the level of aldosterone decreases. That would be another explanation why the use of medication increases the volume of urine, and the result would be a decreased blood pressure. For the details about exactly on which part of the nephron or renal tubule angiotensin 2, aldosterone have their impact, please refer to the video renin, angiotensin, aldosterone. But hopefully in this short video, it became clear that the use of ACE inhibitor decreases the level of angiotensin 2 and aldosterone, and the result would be a decreased blood pressure, because these hormones are affecting different body parts. But the goal would be decreasing blood pressure when we use ACE inhibitor. Hope you find this helpful.